Hello everyone, welcome to QAxon. So in this video, you will learn about the mode of muscle contraction. Under this topic, I will be covering the different types of skeletal muscle contraction. So here we go. Now in day-to-day life, we use muscles for different types of activities. Sometimes we use muscles to move an object, and sometimes it is to sustain an activity. So accordingly, the muscle adjusts. Now we know that the fundamental principle involved in any skeletal muscle contraction is the actin-myosin cross-bridge cycling. But then, depending on the type of activity, the tension can change, the length can change. The length could remain the same, it could shorten, or it could elongate. And therefore, you have different types of muscle contractions. So in the subsequent slides, we look at these different types of muscle contractions defined by changes in the length of the muscle during contraction. Let's look at the first type of contraction, that is isotonic contraction. Now let's use an example to understand this. Say you're lifting a bucket of water. Now you need a certain amount of tension in your muscle in order to be able to lift it. Now to generate this tension, your muscle contracts. That means there's a change in the length of the muscle. So this is called isotonic contraction because here, in order to generate that constant tension, the muscle has to change its length. Now sometimes the length has to decrease, and then we call that as concentric contraction, and sometimes the muscle elongates, and then we call it as eccentric contraction. So isotonic contraction can be divided into these two types, that is concentric and eccentric contractions. So when does concentric contraction occur in a muscle? Let's use this diagram to understand that. So now you have attached a weight to the muscle. Now this is the resting muscle, but in order to lift this weight, you can see that the muscle has generated tension and it has now lifted the weight by shortening. So in this stage, the tension is more than the weight, and that is why the muscle is able to lift it. So that means concentric contraction occurs whenever the tension in the muscle is more than the load. So the earlier example of lifting a bucket of water is also an example of concentric contraction because the tension that you generate exceeds the weight of the bucket. On the other hand, eccentric contraction occurs when you're trying to lift very heavy objects, wherein the weight of the object is much more than the tension that the muscle can generate. So you can see in this diagram that you have attached a weight to the muscle. The muscle is trying to lift the weight, but is not able to generate the tension needed to lift the weight. So the weight pulls on the muscle. So the weight is more than the tension generated in the muscle. And therefore the muscle lengthens. And this is an example of eccentric contraction. Now that we have understood isotonic contractions, let's understand isometric contractions. Now there are some activities where the length of the muscle remains constant. Only the tension changes, and this is what we refer to as an isometric contraction. To give an example, when you have a weightlifter who lifts the dumbbells, while he's lifting the dumbbells, it is isotonic contraction because the muscles are shortening. But once he has managed to lift it and he holds it steady for some time, it is isometric contraction because the muscle is neither shortening nor lengthening during this phase, only tension is building up. But then this is called an yielding type of isometric contraction. This is because after some time, the muscle cannot take this load anymore, and then he may just drop the weight. So the object is not immovable, it is movable. and therefore we call this as an yielding type of isometric contraction. On the other hand, there are other activities. For example, if you're trying to push a wall, the wall is an immovable object. No matter how much you push, you will only generate more and more tension in your muscle, but you cannot push the wall. It is unyielding. So this is an example of overcoming type of isometric contraction. Now in either case, the length of the muscle remains constant. It is only the tension which increases. Now this is a depiction of isometric contraction. You can see that a load is attached to the muscle and the muscle is generating tension, but the length of the muscle remains the same. Now what you must remember about isometric contraction is that isometric exercises can raise blood pressure significantly for the duration of the exercise. And this can be dangerous for people with hypertension or any form of cardiovascular disease. So it is not recommended for such patients. So with that, we come to the end of this session. Thank you.